Hi friends, welcome back to the channel. I have a tentative date for my egg retrieval now. So yesterday I went with my friend Anne-Marie, who is an excellent person to go with for moral support, to my injection training. During this consultation, I learned which medications I'll be taking, and these are all injection medications, sometimes called stims, because they stimulate your ovaries to produce more follicles and have those follicles grow. But because it was having to do with needles, I felt like I needed moral support, so I brought my friend, and we were kind of jamming in the car about like what questions I need to ask and writing notes down and trying to figure this out. I totally forgot that I meant to film the whole thing, which would have been great to reference later when I actually have to do the injections, which won't be until about a month from now. So I thought we might have to actually do the injection on, I don't know, a piece of fruit or something, but we did not have to touch any syringes or needles. It was solely a training for the nurse to show us how to mix up certain medications. Other medications just come ready out of the box. And then she also showed me how to do the injection. And I am still convinced that I will not be able to do it myself. Anne-Marie seems to think that I'll be able to do it because she has issues with needles and she was able to do it with the very small, the insulin size needles. This nurse consultation was with Stephanie, and it was in person this time. So this was the first time that she had seen me because my video wasn't working in the last consultation. And it was the first time that I had seen her in real life. So that was really cool. And she was, again, very patient with me and all of my questions about the biology and the why and what does this do. And even though she had to go over so much of the medication training, the actual look, you gotta take the liquid from this bottle and put it into the powder from here and then put it into another powder and then you're ready. She still took time to go over the biological aspects of this with me, which I love. So the way that the clinic does IVF cycles is they kind of group their patients into cohorts. Usually a cycle will happen just once a month. So they'll have one cohort each month that is going through an egg retrieval process. For the month of July, they actually have 2 cohorts, and I was hoping that I could get into the July 6th cohort, but I'm expecting to get my period on the 6th, so it actually won't work out for me to start injections on the 6th because you need to be on birth control for a little bit of time, or at least that's the way my clinic does it. So our aim is to have me start injections on July 27th. And that means I'll be on birth control for about 2 weeks before then. The reason why they put patients on birth control first is so that there's a little bit more control over where you're actually at in your cycle. And it also creates a disconnect between your brain and your ovaries. So instead of your brain telling your ovaries to produce more estrogen, we're actually giving the body estrogen in the form of birth control pills. And then it keeps you at this kind of neutral state until we start the injections. The injections are mostly going to contain FSH, which is follicle stimulating hormone. And that's exactly what it does. It stimulates a follicle to grow larger. And normally this is what compels that dominant follicle to become the dominant follicle. But we're going to simulate ovulation. We're going to simulate all these things because we want every single follicle to come out and come out big. So we don't just want one to become the dominant, we want all of the follicles to become dominant follicles this time. We want as many follicles as we can get, and we want them as large as possible because that gives us a higher chance for more eggs, a higher chance for more embryos, etc., etc. So we don't want our body producing FSH too early, and we want to give my body the FSH in the form of injections so that all of these follicles are growing at the same time. Now, ovulation occurs when there is a surge of what is called luteinizing hormone. And LH, luteinizing hormone, is normally what causes ovulation. So we don't want that surge until we're ready to grab the eggs from the follicles. And that surge is something that we will also give to my body from an external source. So that was going to be what they often call a trigger shot. Usually that's the night before you do your egg retrieval. You take your trigger shot, and that's what causes ovulation. The trigger shot is called Pregnal, and it contains something called HCG. And I don't know what that stands for. But the timing for that trigger shot is super important. Usually you take it about 12 hours before the actual egg retrieval. And that's what simulates an ovulation. Since we already broke the brain ovary connection, we're gonna give the body the HCG that it needs for the ovulation to occur, and all of the follicles then will be ready for the retrieval. There's another medication that Dr. Kelly might prescribe for me if it looks like my body is gonna be ready for ovulation before we're actually ready for the egg retrieval. And that is called Ganirelix. So that will just put my body in a state of like, okay, we're not gonna ovulate, but it will also give the follicles still a little bit more time to grow larger. There's also gonna be a number of baseline appointments that I go in for. So just like the one that I did in April to get a count of my follicles via intravaginal ultrasound, and also do some blood work to see where my hormone levels are. So I will do, I think, at least one of those before I start injections, and then again when I start injections, and then about 5 or 6 days after I start injections, I'll do another baseline appointment. And at that point, my fertility doctor will be able to say, okay, we need you to change the medication or keep doing what you have been doing. And then 2 or 3 days after that, there'll be another baseline appointment. Again, they will count the follicles, do blood work. And at that point, we'll be able to tell if my body is ready for egg retrieval and at what point we should be scheduling the procedure. At the same time, we have to be working in coordination with Justin's urologist, because he's going to have to get his sperm aspiration done just before my egg retrieval is done, because the sperm has to be ready if we're going to use fresh sperm once my eggs are ready, so that they can put them together. They are going to do what is called ICSI, where they take a single sperm, inject it into a single egg, and that's how they will fertilize the eggs and create the embryos. Knowing that I'm going to be starting injections on July 27th, Stephanie and I were able to determine that the actual egg retrieval should happen sometime between August 6th and August 10th, and that Justin should be in town by August 5th. And he'll be in Philly for that whole week. And that way he'll be ready, we'll be ready. It's very exciting. It's actually happening. We are unfortunately supposed to abstain from having sex before the egg retrieval for 2 reasons. One, if by chance there were some sperm in Justin's semen, there's the possibility that I could have a massive pregnancy, because I'm gonna have a whole lot of eggs that are ready to be fertilized. So we do not want to be another octomom. And the second reason is because the ovaries are full of follicles, they're much larger than they normally are. I'm not supposed to exercise, I'm not supposed to do any kind of like up and down movement, precisely because those ovaries could twist. And if they get flipped, I actually would have to go in for a surgery to fix that before I could even do the egg retrieval. And I probably wouldn't be able to do it that same cycle and push everything back, and it sounds absolutely awful. Stephanie also said that since I'm over 35 years old, I'm 36, that Dr. Kelly might prescribe me human growth hormone, which that medication is called Zomactin, and it is never covered by insurance, and it can run from like $600 to $800. So that would be something that we would pay for out of pocket. That seems like a lot to me, but a lot of this whole process is getting covered by my insurance, which I'm really grateful for. So, you know, I'll have to figure out why exactly the Zomactin would be helpful, and then decide if that's something that we want to do. And I also told Stephanie that we're going to try to get extra sperm, like any extra sperm we can, and just freeze it, so that if I end up doing another cycle of egg retrieval, then Justin doesn't have to have another surgery. We don't have to pay for his anesthesia, etc., etc. We can just use the frozen sperm for any subsequent egg retrievals in order to make embryos. So I am feeling very excited because everything is starting to feel real. We have dates, we know when things are gonna happen, and I've actually seen like what the medications look like. It's a lot of information, and this is, again, just the beginning, because this is only the egg retrieval process. This is not about the embryo transfer at all. And I'm so glad that I've been documenting this, because I am gonna forget all of this in the next 6 months. And to be able to go like look back on these videos and say like, oh my God, we did all this stuff. That's gonna be really, really cool to look at. I am still having a lot of doubts about if I'm gonna be able to inject myself. Maybe, but I really do not think that that's gonna happen. Anne-Marie is convinced that I will be able to, but I am glad I have it set up so that my friends are coming to help me do the injections. They seem kind of pumped about it, which is cool. I'm not pumped about it. Looking at the needles today was scary enough, and I'm just gonna put that to the back of my mind and think about everything that comes after the injections. And I think with everything starting to feel more real and having an actual schedule, something on the calendar right now, it's giving me more of a sense of ease. I'm feeling better about it. Plus Justin is gonna be here for the last few days of injections, so he can do that. I'm just excited to get this really started. Thanks for watching. If you enjoyed this, please subscribe and please like my video.